end with. And the question for all of us is, how do we understand women's health through the key stages? And how can we provide the women that we work with, that we live with, that we share our spaces with? How can we provide them with an environment, a space in which they are always totally and fully included and able to contribute the optimum that they can to our companies, to our homes, to the society? So this is what we're here to do today. And we have a wide array of women representing each key stage in a woman's life. And also not just in terms of age, but also in terms of career journey. So please, I will now go ahead and introduce all the discussants that we have today. I'm joined, first of all, by Dr. Olabisi Olanrewaju. She's our expert on this panel today. I mean, she's a well-renowned consultant obstetrician and gynecologist. She practices here in Lagos. She graduated from the University of Lagos many years ago. I think that would be loose. I didn't have it call it well. But she also has a postgraduate diploma with a distinction from the Liverpool School of Tropical Health. In addition to that, she has a postgraduate master's degree in business administration, and she specialized in healthcare management. Her main area of interest really is women's health. And she has done a lot in this space. She's attended various trainings, both locally and internationally in the US and in the UK, all focused on women's health. So it's a privilege to have her as part of our discussions today. And you're welcome, Dr. Olanrewaju.
Thank you very much.
And,
am I audible?
Yes, you are. It's a pleasure to have you on. And the other women who will be contributing to the discussion and giving us their perspectives, we've chosen them very carefully. And if we could just spotlight each one as I mentioned their name. We have Zainab Olagunju. Zainab Olagunju is representing the perspective of what we've called the trending 20s. She's a young lady who is a skilled professional and has made some remarkable progress in her career to date. She holds a position in Avon HMO as a public relations officer. Prior to Avon HMO, she had worked as a reporter with Silverbird Television. She continued her career with the Enterprise Development Center, and she's always been focused and dedicated to developing a career in corporate communications and public relations. So please welcome a representative of the trending 20s, Ms. Zainab. It's a pleasure to have you here. We can't hear you.
Good afternoon, everyone. Can you hear me?
Yes, better now.
Okay, good afternoon, everyone. Good to be here.
You're welcome.
Yes.
And then we move very swiftly to what we call the thrifty 30s. You might wonder, why do we call it the thrifty 30s? Because we recognize that this is the age at which women are beginning to have a lot more responsibilities, and they better be thrifty at this age. So we have Achalugo representing the thrifty 30s, and I'll just tell you a bit about her. She's a legal practitioner who works at Udoma, Bello, Osagwe, and Co. And she has a career that has spanned over a number of decades. Her expertise is in drafting, advisory, review, and negotiation across various sectors. She's very passionate about bringing knowledge of the law to the average man on the street and woman on the street. And her activities cut across the media as well as the practice of law. She has hosted several radio programs trying to educate the masses on their rights and all things that are legal. She's also a certified associate of the Privacy Academy, a renowned data protection certification agency in Nigeria, and also a member of the Institute of Arbitrators, UK. It's a pleasure to have her here. She's in her 50s, 30s, as I said, but she's achieved so much in her career, and I'm sure that she will contribute quite a unique perspective to our discussions today. You're welcome.
Thank you. It's great to be here. Thanks for having me. Just a bit of a correction. It's Tomi and Partners, not Udo.
I am so sorry. I don't know where Udoma came from. Thank you for correcting me, Tomi and Partners. It's a pleasure to have you.
Thank you, Ma.
Next we have, I'm going to call her Olubunmi Salako because she's here not in her capacity as a physician. She's here in her capacity as a woman that is in her fabulous 40s. Dr. Salako is very high up in her career. She trained also as a physician. She's a consultant pediatrician, holds a Bachelor of Medicine degree from the University of Ibadan. She's also a recognized fellow of the National Postgraduate Medical College. And, you know, she's very well known for her excellence in the field of pediatrics. In addition to that, she's a member of the executive team at Avon Medical Practice Limited, where she heads the quality assurance and the clinical division. She's responsible for that. In addition to her residency at Luz, her international exposure includes an internship in France, where she focused on clinical trials in cardiometabolic syndrome in children. And she earned an executive certification in project management in global health. So as you can see, she's not just your run-of-the-mill doctor. She's a doctor, a physician who is also practically a businesswoman and a business executive. So you are very much welcome. I have to mention that she also has a master's in public health from Lagos State, University of Lagos, I think, not Lagos State University. I think it's from University of Lagos. I'm being very careful now. I don't want to make the same mistake I made with Achalugo. So you're most welcome. And we'll be looking forward to your contributions as a woman in her fabulous 40s. Of course, if there's any angle from the physician aspect that you can bring into it, we'll be happy to hear those as well. And finally, last but not least, we have here on our panel, Faith Nelson-Ojeaga, and she is going to give us the employer's perspective on everything that we discussed. At the end of the day, it is International Women's Day. This is all about inclusion. What are employees going to do based on whatever insight she's able to gain from our discussions today? Faith is the group head of human resources and admin at Avon HMO, Avon Healthcare Limited. She's a human resources expert. She has over 25 years work experience across various sectors. Her career started as a consultant, and she's worked with leading firms such as Accenture, and she was involved in several HR transformation projects. She's also worked in the banking sector and in the insurance sector, and it's a pleasure to have that rich perspective here for us, meaning that she can speak for many sectors when she's looking at all the issues we're discussing from the HR perspective, from the employer's perspective. So thank you very much, everyone. And thank you for agreeing to speak to us today, to all the discussants that we have. And I'm going to dive right into it. And I believe at this point, I will be yielding the floor to our experts today, Dr. Olanrewaju, who is going to just give us some remarks about women's health across key life stages. Dr. Olanrewaju, over to you. We can't hear her yet. Does someone need to unmute her, please?
Good afternoon. Good afternoon, everyone. Happy International Women's Day.
Happy International
All right,
Women's
so there's
Day.
no better place to be than here. I want to congratulate every woman that is here and especially celebrate every man that is here with us today. Thank you for being a part of the movement. I'd like to start from why International Women's Day. The first significant movement from women was sometime in 1909, and then followed by several concerted movements, women fighting for the right to vote, fighting for employment chances for women, spanning all through up until 1975, when the United Nations adopted the 8th day of March as a day to celebrate the women internationally. Now, within this time period, have we made improvements? Yes, there are many wins. Are there still gaps? Yes, there are gaps. And that is why we are having this conversation today. What are these issues that women face? These issues range from discrimination, gender biases, women reproductive rights, employment issues, health issues that are peculiar to women, empowerment of women economically, and generally bridging the gender gaps that we have. Now, we know that globally, women tend to have a longer life expectancy, about 5 to 10 years across the globe, longer than men. However, this period tends to be a lifetime that is spent with chronic illnesses, as women tend to have a higher burden of chronic illnesses in this period. We do know that women are more likely to die from heart conditions. These are some of the peculiar health challenges that women have. And that is why we're having this conversation here today. Now, we can generally classify women across 4 major, what would I call it now? Across 4 major health challenge groups. I put it as adolescents, the reproductive age group, the maternal period, pregnancy and maternal period, and then climacteric and menopause. Now, what are the peculiar challenges that women have across these lifetime lines? In the early stage, adolescent, like within ages 10 to 19, that is when a woman is being inducted, so to speak, into womanhood. She's transiting from puberty to womanhood, and then she begins to have peculiar health challenges, menstrual issues. You have women who have so much menstrual pain, they cannot attend to daily routine activities. She's still learning to understand her body as a woman. She's afraid or timid to share these concerns with other gender or seniors or wherever, whatever environment that she finds herself. But that is a reality. Some endocrine problems also begin to come up. You have women with hormonal imbalances. They're struggling to understand their bodies. Particularly in this part of the world, we do not really have support groups to help women navigate these peculiar challenges. You have a woman who is also beginning to be introduced into sexual activity. She does not readily have access to contraceptive in this environment and in so many other environments as well. These are some of the peculiar challenges that women in that age group will face. Some of them as well would have mental issues, particular to that age bracket because of the transition that is going on. I can imagine a young girl at about 13. I had an encounter recently. She has a disorder that would not allow her menses to flow like other girls. Now, that in itself will not be a challenge. But in providing a solution, we have to make an incision. And when we make an incision, that means we have taken away that hymen that is expected to bleed significantly. So somewhat a societal and cultural issue has been created for that particular woman. So it took a lot counseling her parents, counseling the young girl as to what to expect in later life. Now, for women who are in the reproductive age group, they begin to have their own health challenges that are peculiar to them as well. You have those with fertility issues. A woman that assumes that once she gets into marriage and is ready to reproduce, it shouldn't be a problem. And then you find women going through all of this. Some women also have miscarriages. We do not have formal leaves for women to mourn their losses, to grieve through that period of miscarriages. But it is their reality at that period. That is the period when the woman is also establishing herself career-wise. And that is a period when she might have to be visiting hospitals, making excuses at work. People might not really understand the challenges that she's going through. Of course, we have the women, the maternal period and pregnancy period, when a woman is making choices in regards to career growth, career progression, and raising a family. There are many stressors, family-wise, for the woman in this particular age group. We move to climacteric and menopause, that transitory period when a woman moves from regular menstruation to menopause, and then she's hit by several changes in her body that she never bargained for. So these are some of the challenges that women have. I am particularly intrigued by the theme for this year's celebration, inclusion. And in terms of activism, the inclusion is on two prongs, including yourself as an individual by empowering yourself as a full woman, maximizing your health potential, and also taking active steps to get another woman to be included. What better way to end this than with a quote from a woman of repute, Michelle Obama, that says that the health of a community or a country or maybe the entire world is only as strong as the health of the women. Thank you very much.
Wow, Dr. Olanrewaju, thank you for that really passionate introduction that you've given us. And I don't think I could have asked for a better one, because you've helped us to build the context quite nicely and given us a quote to remember. I'm going to hold on to that a society or a company or a country, it's only as strong as the health of the women that are in it, that are a part of it. And that is very, very true. So thank you for that passionate introduction. I loved it. And I'm sure the people who are listening also gained a lot from it. I was stunned. I knew that there was a higher life expectancy for women, but I didn't know it was as significant as to 5 to 10 years more. So that means as a woman, we will definitely live longer than most men around us that are about the same age. No wonder men tend to marry women far younger than them, you know? But I also didn't know that we carry a higher burden of chronic conditions, and our chronic disease conditions are more likely to result in the death of women than they are to result in the death of men. I didn't know this. I somehow assumed that chronic conditions was more prevalent against men and that men died from it more often. So these sessions are honestly very, very educative for us all. But without much ado, let me move to Zainab. Zainab is going to share with us her perspective as a woman in her 20s, just starting out on her career. What do you want us to know health-wise about the trending 20s for women such as yourself, Zainab? What have you been experiencing? What are your friends saying? What are you going through? Just share your perspectives with us, please.
Okay, so good afternoon, everyone. Again, I'm Zainab, and happy International Women's Day. So I'll just get right into it. So I'll be speaking on 3 particular health issues that we face women in our 20s. The first one is PMS. PMS is premenstrual syndrome. So PMS, dysmenorrhea. Dysmenorrhea is period pain, menstrual cramps, and then hormonal imbalance. So under hormonal imbalance, I'll be speaking on PCOS. So the first one, PMS. So I find that I'll speak about myself actually. So for me, I have PMS and I have what's it called, dysmenorrhea. So I find that so the symptoms for PMS are like mood swings, tender breasts, food cravings, headaches, fatigues, and those mood swings, you see yourself, you're crying, you're anxious, you're tensed, depressed, just because your period is on the way. So, and usually these symptoms don't leave until like 4 days after your period. So for me now that I have dysmenorrhea, you can imagine me going through so much pain in my body, and I'm still facing all the mood swings and all the tender breast, headaches, fatigues, and all of that. So what's the major cause of this PMS is usually your when your hormones are changing of some sort. So yeah, that's for period PMS and dysmenorrhea. A lot of times when I'm on my period, I can't do anything. I can't move. Actually, it's getting better now. Like I would say from when I was like 16. Yes, it started when I was 16. I'll be able to move. I'll be on the floor. Oh my God, my stomach, my stomach's paining me. I can't, like, it's usually really bad. But so that's the issue. But then, because then you take medications, it even gets to a point where medications don't work anymore. The pills, they'll give you ibuprofen, paracetamol, it won't work. So what I started doing for my own self was, towards when I know that I can feel these things, my symptoms and everything coming up, I just quit I don't take sugar that much. I exercise a lot, and then I also eat healthy. I live a healthy lifestyle. So yes, that really helps with the whole pain. Like I don't feel so much anymore. But before I started like putting in effort and actually taking my time to like study my body and everything, it was really bad. So that's for this dysmenorrhea and PMS. So I'll just quickly speak on PCOS as well. I find that
do you have PCOS as a condition, or is just a number of your friends that
a number of my friends have PCOS. So that's
people might not know what that is. Maybe I will ask Doctor, but sorry, I caught you in. Have you finished, or you were just about to?
I was literally about to say what PCOS is, and yes. So PCOS is polycystic ovarian syndrome, where your ovaries have like little bumps you have like little bumps in your ovaries. So that's causes, it's like tiny bumps, and with this your insulin level is higher, so you're prone to like diabetes. You have a lot of male male hormones in your system. You see that you start having a lot of hair and all of that. So symptoms again for PCOS, in my knowledge, is irregular periods, weight gain, acne as well, and then there are like threats to PCOS, and that is it affects your fertility, and then you're also prone to diabetes because of the high insulin and all.
You seem to be muted. Okay, maybe that's a timer going off. Perhaps you want to round up very quickly.
Okay, so I'll just say, with everything, when you face your challenges and everything, it can affect your career, because you come to work, you can't do anything, you're sad, you're going for medical checkups all the time, and you come to work and your work relationships are not balanced, and you won't be able to have those conversations with people because like it's personal stuff, so it can affect your career growth. So I would say exercise regularly, eat healthy, and just live a healthier, fuller life. So I will just round up with that. And yes.
Thank you. Thank you very much, Zainab. It's interesting that you didn't mention sexual and reproductive health, which is good. It's good. Your dad and your partner, if you have one, they'll be very proud of you. That means you have no worries in that regard, because many young women also worry about sexual and reproductive health. Sexually transmitted diseases are a thing. Women are affected by that. I think also what I've heard women in their 20s also worry about when it comes to women's health is nobody's worried about chronic diseases at this stage, but a number of women do begin to think about future, fertility issues. It's a great thing that you mentioned PCOS, but there's also something endometritis. I'm going to call on Dr. Olabisi Olanrewaju now to educate us a bit, because it's like the endometritis, and forgive me if I'm pronouncing it wrong. There are two types. There's endo, there's indo, or something like that. And all of this very painful for women at this age, because they don't understand what's happening. Very, very heavy bleeding, irregular bleeding, very high levels of pain that is associated with the bleeding. I mean, you are in a better place to tell us. So please, Dr. Olanrewaju, educate us on this.
Yes, I believe you're trying to talk about endometriosis. And endometriosis, the simple way to put it is finding the lining of the womb in other parts of the body. So when the lining and the glands of the womb are found in other parts of the body is referred to as endometriosis. And this is a condition that is associated with a whole lot of pain. It's a condition that significantly affects the livelihood of women. One of the challenges that we have is diagnosing this condition. So meaning that because there is usually a time lag between when women begin to experience this and when an actual diagnosis is made, and even when a diagnosis is made, the options of management are somewhat challenging and with their own implications. That means that over a long reproductive lifespan, the woman can actually endure and suffer a whole lot of affectation of her lifestyle.
Wow. Thank you very much for that. I mean, luckily, we also have a number of women on the panel who have passed through the trending 20s. The trending 20s is in their rearview mirror. They will see it again. They've been there, they've done that. So I want to ask you, what advice has worked for you that you'd like to give the younger people in their 20s? And I'll give you a minute each to just say a few things that, look, when I was in my 20s, I had this and these challenges as well, but this is how I coped. Zainab has shared how she's coping with some, but can you share your experience with us, please? And I'll call on Achalugo first, since she is the nearest in age to the trending 20s.
Okay, sorry, I'm trying to unmute. Okay, still great. Okay, do you want me to speak to, you just mentioned some advice for women in their 20s, or you want me to speak generally as to my own category?
No, I think just to the women in their 20s and the kind of issues that Zainab has mentioned, that, look, many women in their 20s now are.
Oh, okay, before we come to the 30s. All right, then. I think the first thing that I always say when it comes to women's health, irrespective of the age, is that knowledge is power. You know, I've realized that so many things that we suffer, so many things that we go through is because we are not, sometimes we're not actively seeking the knowledge. And sometimes, you know, there's some people who we look up to and we expect that, you know, they should give us this information. And for some reasons, maybe they're shy, you know, maybe cultural stereotypes, they're not being as outspoken as they should be. You know, so some of these things often result in the issues that we have. Another thing that I always say is shame. Shame is a huge hindrance for us. Shame prevents us from coming out to say, oh, this is what I'm going through. These are my pains, these are my sufferings. You know, like Zainab mentioned earlier, sometimes you want to come to work and you're unable to speak to your colleagues about some of the things you're going through. I think that, you know, it's something we can work on. Maybe, again, some of these things come with age. Because right now, for me, there's sometimes I make fun, you know, in my office. I won't tell the guys, I say, oh, this is what a tampon is. This is what it's for. I feel nothing whatsoever speaking about periods, speaking about sex, speaking about, you know, so sometimes I appreciate that this confidence has come with age. I do not think I was really like that in my 20s. But looking back, I really just, you know, think that there was nothing to be ashamed of. There was nothing to be ashamed of. There was no reason to be in silence. There was no reason not to speak with your friends. So my advice is just take the shame and throw it away, and then always just talk and seek the knowledge.
Thank you. That's brilliantly put, Achalugo. Thank you very much for that. And may I just add that part of why we're doing this is to remove the shame and the stigma around many of the health issues that women have to go through in the course of their life. And I'm very, very pleased to see us all talking about it so openly. Part of what we're doing is also educating the men amongst us. There's a man in the chat session who has asked the question, and he's put a smiley face on it, that is menstrual period a disease? From my own perspective, I'm going to say, hearing us talk about premenstrual syndrome, hearing us talk about polycystic ovarian syndrome, etc., maybe it's sounding scary to you as a man and other men that are listening in, but I have to tell you, this is what women live with. The period as of itself, the menstrual period of itself alone, it is not a disease. It's not a disease at all. But sometimes the period comes with other issues that affect a woman's health. One of it is the excessive pain and the cramps and the nausea and the premenstrual syndrome. Days before, certain women, I certainly experienced it. Mine was blinding headaches. Like 3-4 days before my period even comes, I would have blinding headaches, you know? And I noticed too that my mood gets affected. You know, I take offense more easily. So these are all things that women have in various degrees. So even though the flow in itself, the menstrual period that comes every month in itself is not a disease, it can come with complications and it can inhibit a woman's ability to completely function as per normal before the period starts, while the period is on, and sometimes even after the period has ended for some days. And for some people, it's not even just about the period itself. It's about the hormonal imbalances that begin to happen. Dr. Olanrewaju has educated us about a young girl who started her period, but the period could not flow out. They had to do an incision, and that involved cutting at her hymen so her period could flow normally. She needed counseling, and so did her parents. So to the gentlemen amongst us here, yeah, period of itself is not a disease, but there are complications around it that can make it something that can preclude women or inhibit women from living a full life in which they are thriving professionally as well as socially. On that note, I'm going to move straight on to Achalugo, who is on today's panel representing the thrifty 30s, that phase of life in which women are settling into families, that phase of life in which women are concerned about having babies, childbearing, and funny enough, that phase of life in which they have come into higher levels of responsibilities in their career. They're probably in middle management. They've worked for quite a while now. So actually, I just want you to share with us what it has been like for you as a woman, your health journey, and those of your friends around this stage in life. So over to you.
Okay, so thank you again for the opportunity to speak, and I'll just go straight into it. So I like to refer to the 30s as that beautiful mid-ground. You know, you're just coming from your 20s and then the 40s are ahead of you. You know, it's a very, very key point, a very key stage of your life. So as I mentioned earlier, that knowledge is power, you know, generally, but I think specifically what my 30s have taught me is that prevention is cheaper than cure. And I always say that because there are some things that we begin to go through, and I just realized that you're suffering this because you have coconut head. So for example, when Zainab was speaking about dysmenorrhea, I just realized one day that I'm rolling in pain, unnecessary pain every single month because I was refusing to give up sugar. The moment I gave up sugar in totality, I said, you know what, I'm not having sugar anymore. I'm not having sodas. There was such a huge improvement. In fact, there was an improvement for the 3 months I stayed off sugar. And then I said, oh, okay, looks like we fixed this thing. And I went right to it again. I took ice cream, and it hit me again. So the moment I just realized that, I was like, you know what, preventing this thing is a whole lot better for me. So I had better keep away from it. So, you know, your 30s is that point where you're coming into this space of, I now have to take responsibility for my health. This is not the point where I can run to my mommy. In fact, I'm at the stage of my life where I have people running to me. You know, so my children are the ones who are coming to do, oh, mommy, this is happening, that is happening. So I have to take responsibility for them and for myself as well. And I would just generally say that, you know, managing your health at this point, the first thing you realize is, especially if you have children, it's not just you anymore. If you're not healthy, then you can't take care of other people. I realized that the moment I'm ill, almost everything stops in the house. In fact, in the beginning part of when the kids were younger, they won't be able to go to school. You know, so when you realize how important you are in the space of things, then you know that taking care of yourself is non-negotiable. So your growing children, you also realize that when these children are ill, you're the one who has to step back from work. So you're in this phase of your life where sometimes you actually cannot come to work and it's not your health, it's the health of the children. You know, I always joke at work, I tell people, I say, if you have a flu, please stay away from me. Because if you give it to me and I go home and one child catches it, it means that the other one and the other one, before I know it, 1 week of my life is dedicated to nursing children. So when the growing children phase, we're also in the birth control phase. after I had all my children in my 20s, and I just realized that, you know what, I'm done with having babies. I don't want babies anymore. And it occurred to me that I never thought about contraceptives. You know, you just think that, oh, the moment you just say with your mouth that, oh, I'm done having children, then that's it. But there really is no magic to it. Work has to be done. You have to be intentional about it. So I started looking at some of my friends, and they would come and they'll say, oh, Acha, that's my last born. No. And 3 months later, they're with a bomb. You know, so you learn from these things. And I'm like, no, I don't want this to happen to me. So I spoke to a few of my friends, you know, and they were like, no, we should discuss birth control. We should go see a gynecologist. What do you want? You know, what can work for you? Do you want the hormonal? Do you want the IUD? Do you want the pills? Do you want the pills? You know, how do you want to tackle this? And of course, in this part of the world, some men do not want to do vasectomies. You know, so you realize that you're almost carrying that alone because the man is saying, no, I'm not going to cut anything. I'm not going to, you know, so these are conversations that you're beginning to have. I also realized that, you know, for some of my friends on my alumni groups, we just suddenly realized we were doing a lot of donations. You know, we moved from those girls who were saying, oh, let's meet up on Friday after work, to much more sober messages on the group that, oh, hey, XYZ babe has cancer. We need to donate for chemotherapy. And it's a very slapping reality. You know, you realize that you're no longer teenagers running around. You're no longer the Unilag students playing around. You're really now somebody who is in this phase of their life where they're actually struggling to be alive. You know, so if they have chemo, you know, you're like, oh, she's my age mate, which means that you're now in the cancer age bracket group. You know, some of my older friends, because their moms had cancer, they're now, even though they're in their 30s, because it's in the family, they're telling you that, oh, I'm going for mammograms. But previously, you would have thought, or you hear that you have to be up to 40 to get a mammogram. So you're now seeing the reality that some people in their 30s actually have to get mammograms. So these are things that you're talking about. In fact, now we're always sharing things. We're like, there's this outreach because these screenings are expensive. Or like, oh, so let's meet up there. And you see us actively planning. You think we're going to the beach. No, we're going to get our breast checked.
You know, pap smears. We're going to get all of these things. And when we go to these places, because okay, so
okay, can you hear me? Sorry, my pods went off. I just need to know if you can hear me. Can you hear me? Okay, great. Thank you. Okay, yeah. So you're now in this space where when you even go for those screenings, even when they tell you, oh, you're fine, you're telling them that, please, you have to check very well, because you're also now hearing stories of people who say, oh, I got to stage 3 cancer, but I was getting checks. It means that something was missed along the line. You know, so you're even more empowered. You're like, no, check this, check that. You're almost acting like, you know, a mini doctor yourself. But one thing I always say is you have to get the right knowledge and don't always go to Google. Because if you go to Google, your headache and your stomach pain, you know, when you look at all these symptoms together, it could be very frightening for you. And then you begin to panic a whole lot more. You know, so you have friends who are having fibroid surgeries. You have people who are now taking certain decisions. So I'll give you an example. My cousin, you know, decided that she was going to school with her 20s. She was going to acquire her PhD, her master's, and all of that. And she wasn't going to start making babies until she was done. Now, when she finished all of that, got a bit of experience at work, she now got to like 35, and then she had some difficulty having children. So now myself and my friends, you know, we're sitting and we're like saying, you know, there's been the evolution of women from, you know, people who just be in the house. We're now career women, but it seems like our bodies are not evolving with us, you know, because you want to use your 20s to get yourself up the ladder, but those are your most reproductive years. And then by the time you've gotten up the ladder and you're saying, oh, I now want to consolidate on where I am, I really now want to move from mid-management to senior management, then there's the nagging thing at the back of your head that, oh, I haven't had children. And then if you now have to struggle with the IVF, so it's there. So, you know, people are now saying, oh, because of these struggles they're encountering, which is natural, because we get to a certain age where the egg reproduction, where the egg, you know, is not as before. So they're now asking themselves, did I make the right decision? Did I take the right choices? Should I have used my 20s, you know, to have children? And I always say that the grass always looks greener on the other side. You know, because even though I had, for example, myself, even though I had my children in my 20s, I do believe that I'm a better mother in my 30s. because I'm more knowledgeable, I'm more empowered. You know, there's a lot more maturity with it. And when I think back, I say, I really think women shouldn't start having children until they're like 28 or 29. But then if you say that, there's the reality of it too, that's the exact age that your egg, you begin to have those issues. So these are all the things going on in your head. Should I have done this? Should I have done that? So I think at the end of the day, it's a point where you realize that I have to take my health into my hands. I have to help myself. I have to do what I want to do by myself. And that will move me straight to the tips. So the first thing that I always say is you have to realize where you're going to. So you know that you've come from your 20s, you're in your 30s, then you have to.
You are not afforded the same ignorance that you could get away with in your 20s. You now have to say, oh, well, since I've gone through this, this is where I'm going to. You're very soon going to move into premenopausal, and then you're going to, be the menopause woman. So now is the time to start gathering the knowledge. Now is the time to start saying, oh, what is going to happen to me at that time? How can I begin now? Because I already know that there are certain things I should stop eating. I already know that there are certain vitamins I should start taking. I already know that exercise is non-negotiable. Exercise is non-negotiable. I used to look at going to the gym as a thing of flex before. Oh, I want the flat abs, I want the six packs, but right now it's not the aesthetics for me anymore. I understand what muscle does in the body. I understand what my weight gain fluctuations can mean for me. So this is a knowledge that I am now going to take into my 40s. And then, of course, like I mentioned earlier, there's no shame. So I have a lot of friends in their late 40s, in their 50s. Some of them are on the call here with me, and I see what they're going through. And I do like that they're not hiding anything from me. I have a friend who's like, oh, Acha, hot flushes. And I'm like, but we just put on the AC now. And then in a minute, she's like, oh, I'm cold. I say, okay, so we switch it off again. So we actually just, we find a way to be humorous with it. Switch on the AC, switch off the AC. But it's now a knowledge I have. I'm like, oh, there's hot flushes waiting for me in front. It does seem like there's no rest for women. Like there's no rest for you. You're going from PMS, you're going from cramps, and then you're going to this one again. Somebody says that they cannot hear. Okay. Madam Icy, can you hear me? Okay, so I'll go on. So like I mentioned earlier, there's no shame to it. Thank you. There's no shame to it. Just keep talking, just keep speaking with your friends, just keep asking questions, keep attending events like this, keep throwing it out. There is no shame to it. There's no shame to being woman. And whatever you're going through, I think we should always find the joy in it. I know it's difficult, but just take your lot with it. If you're struggling with the IVF, if you're struggling with fertility, it's difficult, but I think it's easier if you approach it with a certain mindset. Like, okay, for me, I always say, okay, well, this is it. This is what I've done, or this is what I'm going through. And always be happy to give the next woman tips. Always be happy to give, and the men who want to learn as well, sit them down and school them. So I'll just stop now, and if there are any questions now or later, I'll be happy to take them. Thank you.
Oh, I think I'm muted. Okay. I was saying thank you very much, Acha. That was very beautifully said. And you've given me quite a lot of things to think about and a lot of things to ask our experts, the consultant gynecologist amongst us today, Dr. Olanrewaju, to kind of wade into. I know that, like you've said, in 30s, many women are coming into their major reproductive opportunity years. Even people who are decided, I'm not going to have a baby until later, are now ready to have their babies. They're settling into their families. Fibroids, Dr. Olanrewaju, almost every other woman I know have fibroids. I don't know many women in their 30s or 40s that don't have fibroids. But sometimes they say, oh, well, I have fibroids, but they say it's fine. I mean, what makes fibroid fine for some women and what makes it not fine and problematic for other women? I also want to ask you about cervical cancer and breast cancer, because Acha spoke about it. What exactly do we know? Why is it an issue in the 30s? In previous times, I think there might be an interloper on this call. Yeah, thank you. You know, what makes some women start getting concerned about cervical or breast cancer so early on in their years? Before, we thought it was something that only old women have, you know, but now we're seeing it occurring earlier and earlier. What can be done about it? And infertility seems to be rampant. Even sometimes women in their 20s who thought they would be wise to get married early, they have trouble conceiving. Others are always suffering from miscarriages. What can we do? What of advice can you give them? And Faith, who is our expert on seeing the perspective from the company, I'm going to come to you with a lot of these questions later on. But let's first have Dr. Olanrewaju just advise us.
Thank you once again. So I'll start with the fibroids question. Fibroids are very common in Black women. In actual fact, the book says up to 6 to 7 out of every 10 women have fibroids. But what is the most common symptom that fibroids present with? No symptoms at all. Which means that many more women have fibroids than we're diagnosing. So there are many women walking around the streets, living quietly with their fibroids, and it has not been diagnosed because it is giving them no symptoms. However, for some of the women who have symptoms and present at the hospital because of these symptoms, following evaluation, you may determine that some of them can benefit from medical treatment or non-invasive treatment, or some of them will need to have more invasive treatment. Now, we need to understand that, like Achalugo said earlier, knowledge brings power. We're having a larger percentage of women who are more knowledgeable. We're having access to more diagnostic modalities. So we're beginning to pick these things earlier. These are situations that women would have some 10, 20 years ago and will be dismissed frequently as some sort of traditional or cultural issues or local issues. But now a lot, in fact, if you visit the average market today, the market woman will tell you about a gynecologist. You hear very funny terminologies like my gyno, but they know there is somebody. They know there is somebody who is in charge of the woman's health. And even when they do not have access, they know that, yes, I should be seeing this person. So we shouldn't be surprised that we're diagnosing these things more, it's more common now to diagnose these things. That's for the fibroids. Now, the next one is for the fertility. Now, there is a nexus between our health choices and what happens subsequently. We have women who are getting sexually involved at earlier age, who are not readily accessing contraception. We have young ladies who are involved in sexual practices that are not particularly healthy. And some of these women come down with sexually transmitted infection. Also because of the stigma in the society, they are not getting healthcare from the right places. And so you have sequelae from poorly treated sexually transmitted infection manifesting in later life. I am not saying that is the only reason. Of course, there are many, many other reasons. One that we know is that women are making the decision to start up families at a later age. Because now it is more common to pursue your career goals, like the earlier speaker said. And so when you are at the peak of reproduction, of your reproductive age, in the late teenage years and early 20s, you're not thinking about a family. And then as you begin to approach 40 or mid-40s, that is when people think that, oh, I think I'm more financially capable. I think I can start to have children now. And there are many, many other issues. As women get empowered, so these things also have their downside. As women get empowered, there are also issues in heterosexual relationships. But today is not the right time for that discourse. I can't remember what the third question was.
Yeah, I spoke about the cancers and how come we're seeing cancers earlier now than before. You know, there are many women in their 30s, cervical cancer, breast cancer. Those are the two cancers that I know are peculiarly they manifest more in women. I mean, men don't have a cervix, so I guess they can't have cervical cancer. Although I have heard of breast cancer in a few men, but breast cancer and cervical cancer seems to be heavily tilted, towards women, something women suffer from. And I'm wondering why it's coming up more in the 30s now. What would you advise? How would we go about it?
So there's two sides of the coin. One, we should congratulate ourselves at the advocacy on women's rights and women's access to health has improved over the years. And that is why we're diagnosing most of these things now. There's a lot of awareness. A lot of people will do their self-breast exams. A lot of people will do their mammograms, and then they will come down and say, oh, it's an early cancer, which gives us the opportunity to intervene early and save a lot of women. So even though we're having a lot of earlier diagnosis, unlike in the past, if you compare how the percentages or the numbers of cancers that you're diagnosing early now, it's probably much higher than in the last 20, 30 years. And that's because of advocacy. There are a lot of women groups that are in the NGO space, even at the company levels. You have a lot of corporate organizations that organize health screenings for their staff. You have religious homes that do these things. So we tend to pick some of these cancers early, and then we can intervene. And in the long run, we're saving more women. Now, let me use this opportunity to go a bit further on cervical cancer, because that one is very, very, very critical to us as gynecologists. We have a huge burden of that disease condition in this country, and it is a largely preventable cancer. Now, I believe that a lot of people on this platform are aware that the government has been providing vaccines against cervical cancer at the healthcare centers in this country, I think over the last 2-3 months. But then we now have people who are saying, maybe we shouldn't take it. Maybe it's something else that is directed at reducing the population. Please, let's encourage ourselves. Let's encourage every woman in our space to get these vaccines for the young girls and themselves where relevant.
Wow. Thank you so much for that. I'm going to pause and just help to reemphasize that, because I don't think many women are aware that this vaccination is now available and that it is free. So every woman, you have to tell us from what age to what age should go and get this vaccination, because it actually ensures that virus that causes cervical cancer is not allowed to grow in a woman's body when you have that vaccination. I mean, please forgive my layman description of what the vaccination does. But my understanding is if you get this HPV vaccination, then you will not have breast cancer. And the Nigerian government has recently made it available at health centers across the country, and it is free. I'm not sure, and this is not HIV. This has got nothing to do with AIDS. This is the virus that causes cervical cancer in women. So I don't know if there's also a need to do an HPV test before the vaccination. Somebody is asking that question. But let me just throw it back at you, Dr. Olanrewaju, to just give us a bit more information. Where will we find the list of the healthcare facilities that have this vaccination available? At what age should young women or girls go for this vaccination? From what age to what age is it available?
So, thank you very much. Now, because this is very critical, like I said earlier, I'm going to crave your indulgence to allow me to run through the natural history of the HPV virus. Now, this is a virus that is sexually acquired by women. It is acquired through sexual intercourse, no doubt about that. Now, every woman who has been sexually active has over a 90% chance of having been in contact with that virus. So long as a woman has had sex, yes, we know that if it is with multiple sexual partners, the risk might be increased. But even if it is only one partner, so long as that woman has had sexual intercourse, she stands greater than 90% chance of having come in contact with the HPV virus. The good news, however, is that after this contact, a whole large number of women would clear the virus by their own immune system. a fewer number will retain the virus. Now, for those who retain the virus, a percentage of them will go on to have what you call persistent HPV infection. The virus then goes on to immortalize itself in the cells of the cervix and goes on to cause what we call dysplastic changes in the cervix over a long length of time. Because we know that it takes a whole long length of time for those changes to occur in different stages before we get to the stage of pre-invasive cancer. That means that we have a long timeline to intervene. And that is where cervical cancer screening comes in as a secondary level of prevention. For the primary level of infection, what would be most preferable is to give it to sexually naive women. And that is where in countries where the vaccination protocol has been well established, it is given to women or to young girls starting from the age of 9 years, where you believe, you peg it that these are women who should not have had any sexual encounter. You would agree with me that it makes logical sense that if somebody is come in contact with the virus, then what exactly are you doing with the vaccine? However, because we know that there are many strains of the HPV virus, we would rather give it to a woman than not, because she may not have come in contact with the strain that is implicated or has high risk of that transformation to precancerous lesions. That is why in environments like us that did not have standard immunization protocol for cervical cancer, if you had a cervical screening and we could tell that you had not been exposed to the virus, we will give the vaccine. Even if we are not certain, it is better to give the vaccine than do nothing. So that is the logical sense that people need to understand. And thank you very much for giving me the opportunity to make this explanation.
Yeah, this is very, very good. I mean, even I am interested. So I can now tell all my nieces to go and, I mean, after this, I mean, we will try and share a link perhaps to the health centers in Lagos and in other cities across the country where you can go and get the vaccine. There's some specific questions that people have asked in the Q&A. We'll take that at the end of the session that are specific to this vaccine. And I'm sure that Dr. Olanrewaju will be more than happy to answer those questions later on. And if you can also help us by, maybe having the list of hospitals nearby or a link or some other information that we can share at the end of the session, we'll be very, very grateful to have that. Something else, I mean, talk about shame and stigma and taking responsibility. Actually, I really want to thank you for the frank way in which you say you now engage with the members of staff in your firm where you work now. And it's something that I'd like to encourage as well. I have a younger colleague who reached out to me some time ago and thought that, she could have contracted a sexually transmitted disease and didn't know how to go about it. And I was very, very honored, that she was able to reach out to me, because normally it's not the kind of thing you want to discuss with work colleagues, and definitely not something you want to discuss with somebody in your workplace that is in a position of authority. So at the end of the day, it turned out she didn't even have a sexually transmitted disease. She did have an infection, a bacterial infection, but she had been using all these washes. And I know many of us are guilty of that. These feminine washes that we all buy. I've done it too myself until a gynecologist advised me to stop that nonsense. We think that we need to use these very, widely advertised feminine washes to wash ourselves internally. And more often than not, just, messing about with that place will result in an infection, even though that's not the intention. So I just thought I would drop this here since it's something around stigma and shame. So every offensive smell or every discharge from a woman's body is not necessarily a sexually transmitted disease. Women also have what we call urinary tract infection that has nothing to do with a sexually transmitted disease. So there are many things that come up in a woman's reproductive system that needs treatment. That is not an indication that the woman has been unfaithful to her husband. And I'm saying this for the benefit of the men here. It's also not an indication that the woman is sexually promiscuous or even sexually active at all. They're just things that happen to women's bodies. Because I know, it's not easy, like you said, Acha, for people to open up and to ask for help. But, we can talk to each other. And more often than not, we can begin to do away with the shame and the stigma. So without further ado, I know time is fast spent. I'm going to move right to what we call the fabulous 40. And Olubunmi Salako is here. She's a physician. She's also a consultant pediatrician, but she's not here in her capacity as a consultant pediatrician. She's here to tell us about the fabulous 40s and what women are experiencing in the fabulous 40s with their health. It's also important to note that she's an executive. She's part of the leadership team of a highly successful hospital that is also fast growing. So she has all the pressures that come to women in the later part of their career when they're already firmly established and they have huge responsibilities. And then with her as well, a married woman with a family to look after, my word, your plate is full. So please talk us through the kind of health challenges or the kind of health situations that a woman in her 40s and beyond is coping with from your own perspective, from friends who are a bit older than you. What is going on in a woman's health at this space in life? And what are the lessons you can share? Or what are the challenges that are still a mystery? And what is your perspective and what are your friends saying?
Thank you, moderator. Good afternoon, everyone. I feel so great to be here. And like the other speakers have said, I'm particularly happy that I'm part of the women to share today's discussion with the audience. So there's another day that says life begins at 40. And to many, it means several things. But to me, as a person, I think it means this is the time to start living the life, purposeful living. Taking our health seriously is of utmost importance. And what that means also to me is that we all have to be intentional about our living. Everyone has to be intentional about their living, especially when in your 40s. Why did I say that? A constipation in a 20-year-old is different from a constipation in a 40-year-old. Because the moment you get to see your physician and you're presenting your symptoms, they're telling you, how old are you? Because it's a different ball game. Constipation can mean dietary or wrong diets in a younger woman. But the moment you are 40, they're asking you any family history of cancer and the likes. I'm in my mid-40s, so I can actually talk to you about myself because for once in my lifetime, I'm actually thinking I'm in my premenopausal period, if not even menopausal, because recently all the signs and symptoms I've been having, like they are all pointing to premenopausal symptoms. Like the moderator rightly said, I'm one of the management staff. And last year, I remember it was a whole lot of stress because of the new role. And I was, planning to achieve my goals and all of those. But in the midst of that, I did not realize that I was actually entering menopausal symptoms because all the signs that were happening to me, I was attributing it to stress from work, stress to meet the deadlines, stress to make my targets and the likes. But really, to speak to everyone here this afternoon, I think premenopausal symptoms start in the mid-40s to late 40s and early 50s. And this is the time women experience things like mood swings, like the moment you see them, they are good, then the next minute they are having mood swings, they are so irritable, they are stressed out, they're having symptoms like vaginal dryness, hot flushes, and the likes. A lot of women also gain weight, during their premenopausal period. And this is the time, like I said, we have to be really intentional in what we do. like the earlier speakers have said, you can't go wrong with healthy lifestyle. Lifestyle modification has to be priority. You have to take your health seriously. You have to take your nutrition, your diet seriously. You have to be intentional about getting enough and adequate rest. You have to take your sleep seriously, and you have to go for regular checkups. Really, there's no shame in this. It's just unfortunate that a lot of women issues are very sensitive. You see a woman saying, oh, how do I say this? I'm going through infertility. How do I tell my the next person next to me that I'm experiencing sexually transmitted diseases? Oh, how would the person take me? How would the person see me? You know, but it's more than that. It's far above that. So we have to open up. We have to speak up, and we have to speak to the right specialist, a gynecologist. Because another thing I found out is that most people, once you're a doctor, they just walk up to you, I'm having this infertility issues, they're speaking to you, rather than going to meet the appropriate specialist, a gynecologist. And by the time you say, oh, you have to see a gynecologist because I might not know much about this thing, some of them will take offense. So speaking to premenopausal symptoms, a whole lot of symptoms can happen. Like I said, it happens in the mid-40s, and some have it easy, some have it really bad. But if there's anything I want anybody to take home from here, from this discussion today, is that whatever you are going through, please endure it. You know, there are several things to be done without necessarily taking medications. There are several lifestyle changes. There are several lifestyle adjustments that can be done without necessarily taking medication. And I really want to tell everyone here that please manage it well. Like, manage it well, enjoy it, rather than taking medication, because some of these medications have adverse effects. Like, for instance, if you're taking OCPs, that's oral contraceptive to replace the hormone, you might develop uterine cancers, stroke, hypertension, and the like. So whatever it is that you're experiencing premenopausal, please take it as one of those issues of women and just manage it. For instance, if you're having hot flushes, there's this fan that people go around with, and I see it with a lot of people, you know, when they go for O1 and I'm like, okay, so thinking back, it's not necessarily because they don't want to smell their makeup. It's because some of them are actually going through hot flushes and they don't just want any excuse, you know, in case the place is rowdy, in case the place is, the party is hot. So you see them carrying their portable, you know, hand fan, you know, going about the electronic, the battery charged fan, they're taking it around. So whatever symptoms you are having, it would be nice to speak up. Mid-swing, stress, you know, look, most of the time, women in their 40s, they're either in management or senior management level. So don't take stress to be because of those symptoms that you're having. Like I said, late last year or early last year till end of the year, I was really stressed, and I was attributing all the stress of my premenopausal symptoms to stress from work. But this year, I'm a lot more relaxed, and I'm still having those symptoms. So for once, I admit that I'm premenopausal, or if not, you know, menopausal. Speak to people about it, get help when necessary. And another thing to take note is that insomnia, that's lack of sleep, you know, would come in, and it will come in big. So some people are used to their regular drinks, some coffee, some, you know, so this is the time to avoid drinks like caffeine, any drink containing caffeine. So you might want to do away, you know, from caffeine. Some of us, we live on chocolates. Chocolates also would add to symptoms of hot flushes. So we might need to, you know, cut down on those eating habits that can, you know, increase the symptoms of premenopausal symptoms. Urinary urgency, you know, is a thin line. You're having urinary urgency because that's another symptom. And it might also be a sign of urinary tract infection. So you going to the hospital to check. Let the appropriate investigation be carried out. Find out if it is not UTI, then you know that it is hot flushes. It's premenopausal symptoms that you're having as against urinary tract infection. Spicy food, processed foods are other things to avoid. A lot of us do a bit of alcohol, like red wine, maybe occasionally. That is actually acceptable. But if you're premenopausal or you're entering menopausal, if you do so much alcohol, you can actually trigger and have more symptoms. Other thing to mention is light clothing. So when these premenopausal symptoms come up, it is usually advisable to dress up in layers, such that if you really feel so bad and you really get so hot, you can take off one layer and just be okay with the inner layer, something not so revealing. Another symptoms that can also happen during premenopausal is brittle bone. The hormones are really, really, really dropping. Your estrogen levels are dropping because that is the cause of premenopausal symptoms. Your estrogen levels are dropping, and because they are dropping, you have brittle bone. Tiny, your bones will begin to thin out. So it might be necessary to, pick one or two vitamins there, but, look for multivitamins that has vitamin D or calcium, to help build your bone as against having brittle bones and any little fall or slight fall, you have a fracture. So I've spoken to, healthy diets. I've spoken to things to avoid. I've spoken to, like the appropriate and the necessary clothing. I've spoken to, ways we can endure and manage our premenopausal symptoms, because it's actually not easy combining so many things. And the take home for me, most importantly, is that whatever it is, we should avoid hormonal replacement therapy. That means
I take you on. That is not what I want you to come here to say, Dr. Salako. Let's leave that level of advice for Dr. Olanrewaju, because I actually have a contrary opinion on hormonal replacement therapy. But I'm going to wait for you to conclude and wrap up, because I know you were summarizing, but I've been holding it since that. Why is she saying endure, endure, endure? Women are tired of being told to endure if there are alternatives to take away the pain. We're talking about inclusiveness here. We want everyone and participate fully in all the activities of life, whether it be professional life, personal life, their relationships with their spouses, their husbands. We really want women to thrive. But I will not give any advice. I'm not the expert. We have an expert here. But let me allow you to round up, because you were summarizing. But I've been holding it in since, because you're saying women should endure. Please. Some endurance has thresholds. And I will give an example when you finish.
Okay. So, okay. All right, ma'am. Noted, ma'am. So those were the signs that I actually struggled with, and I'm still struggling with. Like initially I can stay, without an AC on in my office, at home. But now I'm like, oh, this AC is not working. And my husband is telling me that this room is cold. I mean, this is on 16, and at times I come back home, I'm so like, what is going on? Why is everywhere hot? And everybody are just turning, from my girl to my boys, they're just looking at me, that's okay, what's mommy talking about? Because I'm actually hot and they are not. So they're wondering what was going on, like, so like I said, mood swings, the other time I'm good, I'm happy, the other time, like if you just go 1 minute with me, I can just snap, like, and you're wondering, what have I said? What is happening? Did she wake up from the wrong side of the bed? Things like that. So that's it for me. I'm enjoying my mid-40s, but it comes with a lot of endurance. Thank you.
Thank you. You're one of the, what I will say, formidable Amazons. It's incredible. And what I am in that age bracket myself. I'm not even in my 40s anymore. I'm now in my 50s. And my God, menopause has slapped me every and any which way. I mean, nothing really prepares you for it. This is why I was very happy when the thought of doing this kind of webinar came up. I said, look, women need to be able to talk about these things openly and freely, but also like the symptoms and the conditions that come with a woman when she's younger, in her adolescence and early 20s. It varies in severity. It varies in severity. It varies also in types. Some women stroll through their periods. Nobody even knows. They themselves always catches them unawares. They don't know. They don't feel anything. They're as normal and they can carry on normally all throughout. There's no PMS. There's no PCOS. There's nothing. There's no pain. And some women are wreathing on the floor and need to be given injections to calm down nausea, injections to cope with the pain. Some women can't leave their homes. I actually know of people who in younger days used to have to be admitted for the first 2 days and would be in a haze. Dr. Olanrewaju is nodding, you know? I actually have to confess, I'm one of those kind of women when I was younger. You know, partly why I was believing that my menopause should be a breeze. Surely I can't suffer twice. That if I've suffered so much as a young girl with period pain and getting admitted into hospitals just because of period, once I reach menopause, God will consider what I've been through and make me have a light time. It hasn't been a light time. You know, thankfully, I don't have the hot flushes. That's why I said it can vary from person to person. But extreme exhaustion was a thing for me early last year. Extreme exhaustion, up to a point where I started considering whether I had a terminal illness. I thought maybe, do I have cancer? Do I have long COVID? Is there something seriously wrong with me? Why am I so exhausted all the time? Incapacitating exhaustion. In addition to the insomnia you mentioned, for someone who used to be able to sleep as soon as her head touches the pillow, there's no meditation, you know, all these things people talk about, I tried to do. But insomnia, extreme exhaustion, pain in the joints, all I was prepared for was hot flushes. I never got the hot flushes. You know, I was ready to be carrying my own fan because I used to look at my older friends and cousins who, when we are at home, they will have the fan. I used to think, okay, me too, the worst that will happen is I'll be carrying a fan. But I never got those. I don't have to carry a fan. But I did have debilitating exhaustion. I did have brain fog. I did have a number of many other symptoms that are not common. But a certain number of women will experience those. And I would want those women to be aware that HRT is a viable option. For people whose symptoms are really, really minimal, I mean, if it's hot flushes, endure. Yeah, it's okay to endure. What do you tell a woman that finds it hard to even get up from the bed? I know of someone who, how menopause brought such, and mood swings, not mood swings that are like, oh, you know, I'm in a bad mood, I'm irritable. No, mood swings that had to do with depression. She barely could get out of bed. She never felt like doing anything. She didn't see the point in going ahead with life. Unfortunately, has also coincided with the emptiness syndrome. Joint pains, yes, somebody is writing here, joint pains, has coincided with emptiness syndrome. Suddenly her children were all out of the house. Her husband was there, but he has a life of his own. She fell into depression. It's only later on that she realized that actually the menopause was contributing to this whole depression. Difficulty to raise your hands up. I also had that. They call it frozen shoulder. I didn't know these things, and I didn't know all of these things were attributable to menopause. Hence my scare and my apprehension that maybe there's something really wrong with me that I'm not aware of. But thankfully, I saw Dr. Olanrewaju's colleagues who gave me the latest, and like you, Dr. Salako, I was really afraid of HRT because I'd heard HRT will give you cancer, is better, but I got to a point where I simply couldn't enjoy it anymore. I needed help. It was affecting my ability to function, both professionally and in personal relationships. I mean, I'm not married, but I also have friends whose libido took such a downward turn, their husbands started to be suspicious that, do you have somebody else? Because suddenly they were no longer interested in having sexual relations with their husbands. You know, so different symptoms for different women, but today we are breaking all the stigmas and we're doing away with the shame. You know, so Dr. Olanrewaju, you are the expert here. Advise us. People have asked to the supplements. I took all those things, primrose oil, this one, well woman, all of those things. They didn't seem to help until I went on HRT. You know, but please, please give us your expert advice. Let us all be educated today, Dr. Olanrewaju. The floor is yours.
Thank you very much. You know, I had sent you a message to say, let me chip in on the elephant in the room. And I saw your interjection coming in because I had been reading your body language and I knew that it was going to come because, you know, we kept on saying endure, endure, and endure. Yes, that was in the past. Now, women have become more enlightened and empowered that if they need to have the HRT option, it is offered. The rule is how affected are you by these symptoms? If it becomes so badly affected that you need medications, then all we need to do is to counsel you on what the possible side effects may be, and then you take responsibilities for those actions and also responsibilities to be followed up. Because when you're on these medications, we also need to follow you up for the risk. And we do not want to lose women to follow up. We don't want to put you on medications and then you disappear. We can't follow you up. We can't check your lining, the thickness of the uterus lining and all of that. So once you're well educated, it's okay to have the HRT. We don't want women to suffer in silence anymore. We want women to take the options, we lay the cards on the table, and then you make a well-informed choice. That's the rule now. So I was going to add that throughout the age brackets that we have discussed, there is an underlying factor that people do not want to talk about. It is the sexual health. These issues exist, and women live in shame. Women do not come out to talk about these things. I don't know if I'll say that I have been opportune or I have been lucky, or it's just some form of fun of nature on me. I have seen a lot of women in the young ages, reproductive age group, that are having vaginismus, the difficulty with penetration and intercourse. I've seen it in women who are newly married, women who even married as virgins, and then they're having challenges having penetration in that marriage. I've seen women go through it in pains for up to 2 years, 3 years before deciding to seek attention or seek medical help. These things should not be. I mean, it is a vital component of a woman's health, and people should feel free to discuss it. Now, for those who are in the perimenopausal age group, I don't know why Bumi was avoiding talking about that, but you see, the vaginal dryness that also comes with perimenopause and menopause is something that women should talk about. A lot of women experience dry vagina, and even when the libido is not down, they want to have the intercourse, but because the vagina is dry, and because of the possible pain that will come with having intercourse with a dry vagina, they shy away from it. And that becomes an area of conflict in the home. That becomes a stressor for the woman. And there are therapies that we can offer. So women should be free to talk about these things. On a lighter note, I got my glasses less than 6 months ago. And I recall that when I was seeing the eye doctor, after I had noticed certain things, I was just complaining and, you know, telling her all my symptoms. And she just interjected and said, 70 what? I didn't get the joke initially. I kept on, you know, reading out my symptoms. I said, 70 what? 70, when were you born? Because you are entitled to these symptoms. And that's how I came about getting these glasses. So when you get up 40, yes, you expect that all of these things will start to come up. Thank you.
Thank you very, very much, Dr. Olabisi Olanrewaju. I mean, you've made all this so relatable and so easy for us to understand. Before we round up, I want to give Faith an opportunity to say a few words. We've spoken so much about the health issues that women face through these key stages. We've also followed women from, you know, the early stages of their career, what they go through health-wise, what kind of challenges they have, to the mid-career woman, middle management in the 30s, to the senior executive career woman like Dr. Salako, Olubunmi, as I want to call her today, and not doctor. You know, we've had all, I've also shared my own personal experience. So how, as employers, how can we create a more inclusive environment for women, given all these things that we've been describing? You know, what can you speak to Is it a cultural thing? How can we influence work cultures so that there's less shame, less stigma? How can we ensure that women have the opportunity to share these things, if necessary, with the HR function? What can a company do? What can employers do? So if you just tell us this, your thoughts, your perspectives in a few minutes, then we go directly to Q&A. Thank you, Faith. The floor is yours.
Thank you very much. This has actually been very interesting and engaging. And so starting from Zainab all to Achalugo and Dr. Bumi, it just helped me to reflect in the past about my own journey as a woman. So when Zainab was talking about PMS, mine was actually Zainab, I can relate because I really had painful periods, so I can understand. And even after that, even during the period, before the period I had pain and during the period itself. And we didn't mention even postmenstrual syndrome, where even after the period, some people actually suffer from headaches, nausea, back pain, and so on. So it's actually, I could actually relate. And Achalugo, when Achalugo was talking about hot flashes, put on the AC, put off the AC, I was like, Achalugo seems to be talking about me. It seems as if we're in the same office. I think my colleagues have actually given up on me. So I totally understand. So coming to what we as HR professionals can do, I think Achalugo actually hit the nail on the head when you said communication is key. Remove the stigma. It's not a stigma. It's nothing to be ashamed about. So having that open communication, training our managers, both male and female. So I want to give an example. I used to have a male colleague who had someone reporting to him, a lady, and she used to have really painful periods, he actually was the one coming to me to say, no, do you know what? I need this lady to work at home for a couple of days, for a couple of weeks. Oh, she's going to have a surgery. Can she take some time off? He was the one championing and supporting her. He will come to my office with her to speak with me on how we could support her. And this was a gentleman. It wasn't a female. I've not even had as many female women, HODs coming to me to say, oh, my colleague is suffering from this. It was actually a man that did this. So we can actually have that opening communication. So for instance, for us here at Avon HMO, we have knowledge sessions. And so taking advantage of these knowledge sessions to talk about wellness. So not just about male wellness, but female wellness. Make it open. So the men are able to understand better. We have a lot of men as managers. And so if we don't have these open communications, they don't know how to support. And so the women are afraid to go to their male managers to say, do you know what, I'm having this challenge, I'm having this support, this issue. And so they just either they stay there and suffer in silence or just stay off from work. So we need to have that open communication. We need to destigmatize anything that has to do with women's health, whether period, whatever it is they're going through. It also goes for us, people that have young children. Where sometimes you have a young girl maybe having a period, the brother asks, what's happening? Oh, she's having tummy pain. You could also educate, oh, she's having menstrual pain. And so when he asks, what is menstrual pain? You explain. So he grows up with that knowledge. So we should also look at areas where we educate our children. Then wellness, we have what we call employee assistance programs. And so what is this? Ensuring that you have programs where the women were well supported. For instance, in our premises here, for women that are breastfeeding, we have opportunities where you can have a safe place, what we call like a soft room, where you can have a safe place to just, if you're breastfeeding, you need to express, you go to a corner, a room well furnished, and you can just go there and express, your breast milk, and you feel safe and you don't feel, some women, in some organizations, you have to go to the toilet, you have to go to the cubicle or the bathroom. So always just being deliberate about the policies, and the culture around how do you best support women, and just not trying to pretend that it's not happening, and even when, of course, Zainab and Achalugo had talked about exercise, having a gym for men, the gym actually supports both the men and the women anyway. So having a gym, if no matter how small it is, if your premises, of course, can accommodate it. So we have that. So our people can go to the gym in the mornings or later in the evenings, especially in Lagos where there's traffic. So they use the opportunity to spend some time in the gym, and as much as possible, we also have, when women are going through certain challenges, they also have that, they need to talk to somebody, sometimes they're going to some trauma, do not knowing who to talk to. So organizations can also have, where they have connections. You can do this through your HMO. So for instance, through Avon HMO, for instance, you can say, okay, do you know what? Can we have specialists that you can connect our people to? Can we have mental health specialists? Can we have psychologists, psychiatrists that my people can tell, because going through one trauma or the other. So for instance, you want to, someone is going through some premenstrual or postmenstrual symptom and you want to have someone support them. Can we have a contact with a Dr. Olanrewaju? So Avon HMO makes, does all the logistics for you, connects you to such a person. So I think it's just being deliberate as human resource professionals. One, the communication, knowledge sessions, resource materials, just as we have shared on, on the charts, where you can have cancer screening. HR professionals, be proactive around sharing materials and resources where everybody can read, and then also deliberately training our managers, both male and female, on how best to support our women. What are the issues they can come across, and how they can best be supported. Having that infrastructure in place. And also sometimes in some organizations, another thing you can do is even just taking a survey, asking your women, how do you want us to support you? How best can we support you? So even from that survey, you can say, okay, what are the quick wins? What are those little things I can begin to put in place and do now, so that at least I can immediately begin to support my colleagues, in this journey, because it's an interesting journey, as interesting journey. And yes, as much as we try to enjoy it, and also get support, speak about it, shout, open communication, don't hide it. It's nothing to be ashamed about. It really isn't. Thank you.
Thank you so much, Faith. I liked that. I mean, communication and education, it's crucial. And then training managers. I have a friend who actually is very senior she's a very senior executive. In fact, she's just been posted to Qatar to head her company's operations for that part of the world. And she told me that what she had a problem with was memory loss, that she didn't even know it was connected to menopause. She's this high-flying executive who suddenly would be in meetings and she would freeze because she wouldn't even remember what she was doing in the meeting.
Yes.
She'd be in meeting with other executives from other parts of the world and she would literally freeze. She would have her slides, sometimes no slides. She said she would just forget what she's supposed to say and what, and that one day she just broke out and started crying in the middle of the meeting. And thankfully for her, there were other female executives who were older than her, who came to meet her afterwards. She excused herself from the meeting. They came to meet her afterwards to ask her what the problem is. And when she told them, she couldn't understand why these days she was just forgetting things she couldn't remember. They smiled and told her it was menopause. And she went for her checks and because she'd done everything else and she was fine. Like me, she thought she had a chronic or an illness, a serious illness. And she'd done all kinds of tests and she was supposed to be fine. She was quite frustrated, not understanding what was going on with her. So I particularly like that one that you mentioned, Faith, of training, not just the male managers, but even the female managers, because we do know every woman's menopause experience will not necessarily be the same. Just like every woman's own, period experience or fertility experience will not be the same, So thank you for that perspective from the employers and the HRs of companies and how they can support. I'm just going to add to it to say, look, if you don't have a health plan for your staff, you should get one, because a lot of the wellness and preventive initiatives and interventions that can happen is covered under an HMO plan, definitely under our Avon HMO plans. So if there's anybody listening and you don't have a health plan, you should get one now, because most of what you need, if not everything you need, is covered under the plan. So I want to say thank you now as we move into the Q&A. So I will quickly open the questions. Some of them are one-liners, Dr. Olanrewaju, that you can quickly answer. The ones that need for discussion, I will save for later. And I'm going to start from the very first one. It's a technical one. It says, what are the prospects of having a baby while being treated for prolactinoma? I don't know what that is. Dr. Olanrewaju, over to you.
I'll say fairly good. I'll say fairly good. So long as you're getting the right treatment, it's not a closed option. It's not closed. Not closed.
Yeah. So you can, the prospects are good.
Fair.
Fairly good. Fairly good. Okay. Next question. Is the HPV test also free? I was told I need to do an HPV test before I take the vaccine. What's your answer?
From time to time, a lot of NGOs offer free testing. But you can approach any of the labs who also offer reduced rates during the celebration of the International Women's Day.
Yeah, in fact, let me just emphasize that. During International Women's Day, the whole month of March, many of the practices, with them diagnostic centers, with them hospitals, will be doing heavily discounted women wellness tests. So if there's anything that anyone is unsure about as a woman that concerns women's wellness, this is the time to actually go and do those kind of tests. Next question is from Grace. Can the vaccine be taken by all age groups? I initially thought it's for 9 years old to 15 years.
I think I answered that earlier with my explanation of what is preferable and what is permissible.
Yeah, you said so. Now, can someone with very tight vagina take pap smear tests? How?
It is possible, but of course, the person with that tight vagina possibly has an illness that needs to be treated. So if she finds herself a gynecologist, she'll get treated and she'll cease to address herself as somebody with a tight vagina.
Okay, I hear you. In addition to living a healthy lifestyle, exercises, healthy food, what role do supplements play? Me too, I'm interested in this because I can tell you I've taken all kinds of supplements. I've stopped now that I'm on HRT, but I still have friends who swear by one or the other supplement. What is your response to this?
Because I'm going to be very frank and honest with you. I do not know why we moved from natural foods and natural agents to supplements. We had the older generation who ate natural foods, who lived healthy. I mean, it's the simple life. It is easier to do these things. Take your regular vegetables, take your regular fruits, take adequate rest, take enough water, avoid alcohol, avoid tobacco, avoid stressors, and you will do well. But you see, this is an area where the big farmers have infiltrated our space, and they've marketed the supplements so well that almost everybody thinks that they need supplements. Yeah, there are situations where we recommend supplements, but we can invest our money in cheaper alternatives, which is healthy eating, exercises, rest, water, and we will do equally well.
So what people say, mind your business and drink water, is actually health advice. The next question is on the HPV. I think you've answered this. Can someone who is not sexually active at 26 be given the vaccine?
That is the best person to have the vaccine. Sexually naive. I said that earlier.
Yeah. There's someone who used to have a 28 to 29 day cycle, but now has moved to a 30-something day cycle. Should she be worried?
Yes, she has an irregularity, but it is not outside of what we expect to be normal. So if you have a cycle that is going between 21 to 35 days in terms of length, it is still normal. But because there is a variation in your own individual cycle, which is one thing that women don't get to understand well until they are well educated. Every woman has their own individual cycle. It's not based on the calendar. So you may need to sit down with a specialist who will look through your records, who will ask you further questions and know if you should be worried or not.
Very good. Constipation. Somebody is saying that in her 40s, there's so much constipation, even though water and vegetables have been helping. Is this something she should worry about? Should she go see a doctor?
At 40, I remember Bumi saying that if you have constipation at less than 40, it is different from if you're having constipation at above 40. Yes, I think she might need to sit with a specialist, with a doctor, and then they can elicit further information from her to know if she should be worried or not.
Very good.
But like somebody said earlier, one of the challenges we have in our environment is that if I need to ask questions about my hair, I'll speak to somebody who knows about hair. If I have 1.5 yards of material and I need to sew a particular style, my fashion designer says, no, it won't work for this time. I'm likely to take the advice. But we find that in our environment, people like to take advice from people who are not specialists in that area. You find persons who will come and still be arguing with the doctor to say, but I read on Google. But my friend says, situations can be different. That point has been made repeatedly today, that every woman's experience is different.
Yeah.
even though the general rules apply.
In fact, can I add to that? And can I warn us all? Because somebody approached me when I said I was on HRT and asked me what I was taking. That because she too wants to take HRT, that in fact, another friend of hers was on HRT. She has taken that one's medication. She went to buy it for herself. She has started to take it, but it's not helping her. I should give her my own so she can go and buy my own. I refused. And I want her, if I gave her the number for my gynecologist, I said, better go and see a gynecologist for yourself. Because each woman's body is different. Don't go taking medication just because a friend of yours that seems to have similar symptoms is taking that medication. And it applies for women's health as well. So I just wanted to add that on because I had that personal experience. Do premenopause symptoms feel like pregnancy symptoms? I don't know. I mean, I wouldn't say so, but let me ask the expert, Dr. Olanrewaju.
So the joke in medical cycles or in medical school is when it comes to PMS or menstruation-related symptoms. If you have a multiple choice question in medical school, almost everything could be correct because these are areas where research is still ongoing, where women describe various experiences. I mean, I listened to Achalugo say that once she stopped sugar, that her menstrual symptoms were no longer in existence. And, you know, the books, the science doesn't actually support that as of now, but it is the experience. So let me shock you further by saying that we have enough data to suggest that there's paucity of scientific data in conditions that are peculiar to women. So perhaps we need to do more research that are women health focused so that we can have answers to these things. So yes, many people describe a number of symptoms that are peculiar to them, that science has not given credence to, but it doesn't change the fact that that is their own unique experience.
Thank you. In fact, I forgot to say that too, that when I was young, oh my gosh, I was told to stop eating sugar. I stopped eating sugar. I was exercising. I did all those things Acha did that worked for her, but none of them really worked for me, you know, and even now during menopause as well, I did everything everybody said so that I could endure, but none of them worked for me. So I guess the thing to take away is that every woman's body is different and it's better to go see a specialist. Good afternoon. Can one with premenopausal signs also still get pregnant? I laugh. Dr. Olanrewaju, we have some friends that had accidents, don't we? We all know of women who had accidents that thought they were menopause and they were home free. And next thing we knew, a baby is on the way.
If you understand the science of the pre-menopause, the climacteric and pre-menopause period, what you have is a disordered control of ovulation. In that disorderliness, things can happen. So we say the dogma in medicine is never say never.
Ever. Now, somebody wants to know that she used to stroll through her period without so much pain. But recently she had a surgery last year. And since then, her period comes with a lot of pain, with a lot of pimples, etc. Now, would you recommend for her to go see a doctor? Why is this happening to her?
Yes, I would recommend for her to see a doctor. I really would like to know what kind of surgery she had as well. So, I mean, she needs to be further evaluated so that we can get the facts and be able to offer expert advice.
Very good. Now, can a 13-year-old have mood swings during her periods?
Is she menstruating?
Exactly. If she's having periods, then I guess she can have mood swings. What causes fibroid? I don't know this. I'm quite interested in this as well. What causes it? Why do many of us have it in Africa?
Medical science till date has not told us a singular cause of uterine fibroids. But what we know, of course, like somebody said earlier, it is a disease condition of women because, of course, in the womb, if you don't have a womb, you cannot have fibroids. That's one. We also know that the main hormone that makes us women, estrogen, supports the proliferation of fibroids. So long as a woman, and especially a Black woman, your risk of having fibroids are increased.
Thank you. Now, you already talked about supplements, so I won't go there. There's a question, prolactinoma or prolactinema? Which one is safer to be pregnant with?
Okay, so that person is going technical here. You have a prolactinoma, a mass, you have a prolactinemia, a high level of the hormone in the bloodstream. Are they related? What is the primary cause? What is the etiology? What is the cause for this in the first instance? And that is what will determine what your chances of achieving conception will be. So it's not usually easy to just pick up on a symptom and make a diagnosis and then prognosticate on it. We need to establish a definitive diagnosis before we can now talk about what your chances are, what your risks are.
Very good. Now, for the test, I guess this is the HPV test and vaccinations. Is it accessible in Ilorin? You've shared a link with us. I'm sure, is the link for nationwide centers, or is it just Lagos State?
This has been on for many years, and finally we have it with us, and people should take advantage of it.
Okay, thank you. There's a question here about prostate cancer. I'm sure that's from a man. Sorry, today is Women's Health. It's International Women's Day. And unfortunately, we have a gynecologist here who is not an expert on men's reproductive health. So I'm going to suggest that this this question be addressed to another doctor who is a specialist.
We're celebrating all the same for being a part of us till this time.
We celebrate you, please. I don't mean to sound dismissive, but the doctors we have here today, that is not their area of specialty. And you might need to find a doctor that specializes in that. Next question, at what age exactly does menstruation start? Wow, I know sometimes as early as 9, some 10, you know, and Dr. Olagunju is nodding, so she kind of agrees with that. How can fibroid be managed or prevented? And that's the last question.
So I said it earlier that the most common symptom that you have with fibroid is no symptom at all, which means that a lot of women are walking around with their fibroids. It doesn't give them any reason to present to the hospital. It's okay to continue to live their normal lives with the fibroids in there. But if the fibroids gives you any symptom, we need to review and look at the symptoms and look at how it's affecting the woman in order to prepare solutions that women who could benefit from medical treatment. And there are many factors to consider. What is the age bracket? How close are you to menopause? Remember that I had mentioned that estrogen plays a major role. If I know that your estrogen levels will reduce very soon, and that will also, and your symptoms are not that gross, and that will reduce the estrogen supply that helps the fibroids to proliferate, then I can offer some form of conservative management. So there are many factors to look at. I mean, are you trying to get pregnant? Are you considering fertility? Have you completed your family size? Many factors that come to bear, which brings to fore again the points that have been made. It is not enough to say, my friend had fibroids and this is the treatment that was offered. So if I have fibroids, that is the treatment that should be offered. What we offer is individualized treatment. We look at you, we look at your circumstances, we look at the factors, and then we'll offer you what is best in your circumstances.
Excellent. Thank you so much, Dr. Olanrewaju. This has been highly educative for me. I'd like to thank all the people who are also being discussants with us on our panel. A big thank you to you, Faith, to Olubunmi Salako, to Zainab, and to Achalugo. And I believe that Achalugo also has a few words to say. I can't see her on screen right now. But for all our listeners, I mean, this wouldn't be possible without you. You know, thank you for signing on. Thank you for staying this long. And thank you for listening to us. And I hope that all of you will help to take the messages back into your spaces, into your workplaces, into your friendships, into your relationships with your spouses. You know, you can engage with the women folk in your environment from a place of higher levels of knowledge, education, and understanding about the health of a woman across the key stages of life. So please help us to spread the message, no shame, no stigma. And before we round up, I'm going to give the floor to Achalugo just to say a few words to close up the session. Can someone unmute her, please?
Okay, so I would like to say a big thank you, first of all, to Avon HMO for putting this together. Because oftentimes I say that certain companies are so driven by capitalism that they forget that, there's outreach that they can do, there's education that they can do. So thank you to everybody. I'm just repeating your thank yous. Thank you to everybody. Thank you to Dr. Olabisi Olanrewaju. Thank you, Zainab. Thank you, Olubunmi Salako. And thank you, Faith Nelson-Ojeaga. It's been awesome being on the same panel with all four of us, very wonderful women, very wonderful perspectives, and a lot of the learning points. I was taking notes. Every time that you saw my head move this way, I was going to either type or jot on my notes. So for some people who are just joining in, we've gone through the disadvantages of miseducation, the myths of it. We've spoken about people getting the wrong information. Sometimes, very quickly, I was saying that I did have a friend who needed to do a fibroid surgery. I had a friend who needed to have a breast lump taken out, but instead of going to the hospital, there were people who were telling them that, oh, you can pray it over, you can rub this, you can rub that, so webinars like this are important for us to address those things. There's the place of religion, there's the place of spirituality, there's also the place of medicine. So we should encourage people around us, always go visit a doctor. Someone in the comment section said she's in her 30s, she's always having cramps. I don't think there's anything normal about having cramps. I don't think so. I don't think we're meant to have cramps, but some people just say, oh, endure it. But it may be a sign of something you need to get checked out. It may be endometriosis, it may be something more. So please don't just lie down, go and have it checked out. And then there's one more thing I need to say. We need to embrace aging. There was a time on Twitter that some lady, put out a jab, and then she said, oh, premenopausal baddies. And it was meant to be like insulting. And I was like, we wake up every day and we say, oh God, we want long life. And this long life is being granted to us. We're aging, and then we're being shamed for aging. It's a very, very sad thing. And I don't think women, girls, should be caught in circles where they're having these sort of conversations and you're shaming older women. Because at the end of the day, it's where we all want to get to, is where we all want to be. So let's embrace aging. Let's embrace, I used to look at, like, I have about 3 gray strands here. And I would say, oh, should I color it? But now I'm like, it's gray. So let's just move with it. It's beautiful to age. Aging is answered prayers. The skin will not always be what it is in your 20s. It will not be what it is in your 30s. Just embrace it. We're going to age at the end of the day. So, and then there's some things we can do. Dr. Salako mentioned, ditching alcohol. I think specifically for women, we would suffer a bit more from taking a lot of alcohol than men would suffer. So it's something we should be conscious about. I would personally say just leave it alone. But if you do want to indulge, just a little bit, one at a time. I would also really like to thank Avon for bringing in the HR perspective, because sometimes at the end of the day, we're not in isolation. So we're women in the workspace, then it means that our organizations matter. It means the sort of policies that they have matter. It means the sort of bosses that we have matter, the people that we report to. All of these people form part of what is going to decide the quality of our lives. So a huge thank you to that. I do like the idea of training HR managers or training heads. I've never heard that before. So I think it's something really, really brilliant that organizations should take up. I also want to give a feedback to organizations that it's great to use feedback, because sometimes they put out a lot of surveys. They say, oh, we want to do this for our employees. And then employees actually suggest how their lives can get better, but there's no use, like the feedback is put to no use. So let it just be like a win-win. Let the employees give feedback, let your organizations use them as well. And sometimes we can help our employees. I like to say that people should learn to shut down work. So you can't host webinars, you can't host talks, you can't host all of these things, and you're sending an email to your employee at 7 p.m. and expecting an immediate response. So these are the things that affect, when we're all saying we're all stressed. If you expect people to start work for you at 8 a.m. and at 8 p.m. they haven't shut down for the day, there's, is in their head, I'm still at work. So these are things that we can all, do to, as we say, optimize women's health. So thank you to everybody. I also want to finally say a big thank you to the team. I almost feel like I'm an Avon staff, because I know their names, Adioye Falade, Omolola Makinde, Victoria Chukuma, Korede Taumo, and Zainab. I've been receiving emails. We've had the dry runs, and I really want to commend the work that the team has put together in ensuring that today has gone well. So thank you to the team, and thank you to all the participants for logging in. We did say you should join us for your lunch break, but this has gone on for 2 hours now. So thank you for not logging out. Thank you for your comments. Thank you for your questions. And I do hope that Avon would have something again like this next year. And I hope to at least join, have more people join in, and see us again next International Women's Day. Thank you.
So thank you very much. Happy International Women's Day. Bye, and please take care of your health. Bye-bye, everyone.
Ẹgbẹ́ ẹlẹ́mu. Ẹgbẹ́ ẹlẹ́mu òṣì.